every trace of the blood record, the safety record, for the last 30 years. There aren't any receipts of the donation camps that happened in prisons all over the United Kingdom. There aren't any receipts for any of the blood products used during the infectious period. We'll talk more about that. Starting off with basic transmission routes. First risk when you walked into an NHS hospital was the risk from a transfusion. That risk is itemised at 2.5% of transfusions were infectious. That's been admitted again and again by our government. Where they're clever is they don't admit how many transfusions happen. There were a minimum of 500,000 a year. That is a lot of transfusing. No one can remember they had a blood transfusion on the whole. 53% happened during surgery. An awful lot of the other ones happen with an opaque bag or a yellow bag. In fact, just about the only patients told they have been given blood are the ones that have high unit usage. You'll be told you've got a new heart valve, you'll be told you've got a new kidney, you won't be told you've had 3 units of blood. If you've been in a car crash, they say, hey, we had to give you 10 units of blood. You lost a lot of blood. You should get tested. That's the paradigm. America has sent something like 300 million letters of warning. So has Canada. They've mailed everyone 3 or 4 times. Blood products is your second major process. Very few people realise the sheer numbers of blood products that are out there. You've got internal stitches, you've got surgical strips. One of the key blood products is the factor VIII concentrate. However, the factor VIII concentrate affected all of our haemophiliacs. Very few people really understand that the C-section mothers were given immune D-globin. And immune D-globin was a product called GammaGuard, withdrawn from the market in 1994 for being Hep C infectious. GammaGuard has probably infected more people than factor VIII in the UK, and yet I've hardly heard anyone hear the name. Our mothers went to the government with being infected with hepatitis C. We blame GammaGuard in 1991, and nothing ever happened. C-sections in Germany, basically GammaGuard was withdrawn, and in eastern Germany there are 1,000 women got it. I've got another one of these on Ireland, but there's a report of 1,000 women there too. You know, if Ireland had 1,000 infections, how many have we got? Big question. Dialysis is a far larger disaster than a lot of people realise. There are 35,000 people using dialysis on an annual basis in the UK. Infection levels at least 1 in 10 and maybe higher up until 1990. We have 10,000 organ transplants a year. The bulk of those, about 9,000 kidneys, then maybe 1,000 hearts, livers, eyes. However, up until 93, none of them were tested for hepatitis C. And when they're put into people, they're put into people with immune boosts as well. The organ might be infected, the blood during putting the organ in might be infected, and then the immune globulin preparations to keep it in the body might be infected. This is why you find that the French prevalency model was to take, say, dialysis patients and see how many of them had Hep C, and they'd find 30%. Whereas the Canadian prevalency model would be to go for looking at blood. Oh, it's 1 in 39 infections. They went product by product rather than patient by patient. But what happens is when you go by patient cohorts, you see that they've got far more Hep C than actually just blood alone could explain. So they weren't just getting Hep C from the blood, they were getting it from the organs, they were also getting it from the blood products. Triple whammy. Beyond organs, you've got C-sections. The key thing about C-sections as a cohort is they're still alive. So a lot of our C-section ones are out there and need their tests right now. All of our infected patients are reaching that age where they'll be prescribed death via ibuprofen, death via paracetamol. Alcohol makes Hep C 2 to 4 times more dangerous. This is why the undiagnosed nature of our healthcare Hep C epidemic is so dangerous at the moment. So massively dangerous. We have the largest amount of undiagnosed healthcare patients for the longest period of time per capita in the world. Surgery. 99% of people who go to hospital think they've had an operation and they will think, you know, oh, I had this done or that done. Very, very seldom do they know whether that surgery involved a blood risk. But very often is the case. CLOTS factor A, more than anything, was a clear sign drug companies know. And it set almost a paradigm for the whole health industry of trying to minimise how much damage Hep C does and minimise how often it's infecting people.